Overview about hepatitis. Hepatitis, a term synonymous with liver inflammation, stands as a significant worldwide health challenge, impacting millions of lives across the globe. This ailment presents a diverse range of types, each characterized by its distinctive causes, symptoms, and strategies for prevention. In today's video, we will learn about the facets overview of hepatitis, shedding light on its various forms and providing insight into preventive measures that can be taken. First of all, let's find out about the common types of hepatitis. The domain of hepatitis encompasses a spectrum of 5 primary types: Hepatitis A, Hepatitis B, Hepatitis C, Hepatitis D, and Hepatitis E. These classifications are born from a variety of viruses, each wielding its distinct mode of transmission. Hepatitis A, HAV. Predominantly, this variant spreads via the consumption of water and food contaminated with the virus. Often thriving in unsanitary environments and poor hygiene conditions, hepatitis A typically takes an acute course, with chronic infections being relatively rare. Hepatitis B, HBV. HBV transmission occurs through direct contact with an infected person's blood, semen, or other bodily fluids. It can also be passed from a mother to her child during childbirth. Unlike hepatitis A, hepatitis B can evolve into a chronic condition, leading to progressively severe health complications over time. Hepatitis C, HCV. The primary mode of hepatitis C transmission is exposure to infected blood. Commonly linked to unsafe medical procedures, intravenous drug use, and, to a lesser extent, sexual transmission, hepatitis C shares similarities with hepatitis B in its potential to develop into a chronic state, resulting in significant liver damage in the absence of intervention. Hepatitis D, HDV. This variant solely affects individuals concurrently infected with hepatitis B. Categorized as a satellite virus, HDV's replication necessitates the presence of hepatitis B. HDV accelerates the progression of liver disease. Hepatitis E, HEV. Hepatitis E is predominantly transmitted through the consumption of contaminated water, paralleling the mode of transmission of hepatitis A. This type is most prevalent in regions grappling with inadequate sanitation and restricted access to clean water. While typically acute, hepatitis E can manifest more severely in pregnant women. So, what causes hepatitis? With its diverse forms and potential for serious health consequences, understanding the underlying causes of hepatitis is essential for effective prevention, early detection, and management. The primary cause of hepatitis is viral infection. Different viruses are responsible for the various types of hepatitis. These viruses differ in their modes of transmission and the resulting impact on the liver. Hepatitis A, HAV. This type is usually contracted by consuming contaminated food or water. It's commonly associated with poor sanitation and lack of hygiene. The virus is excreted in the feces of infected individuals, and when ingested, it can lead to liver inflammation. Hepatitis B, HBV. HBV spreads through contact with infected blood, semen, or other bodily fluids. It's a significant global health concern due to its potential to become chronic, leading to severe liver damage, cirrhosis, and even liver cancer. Hepatitis C, HCV. HCV is mainly transmitted through exposure to infected blood, often linked to unsafe medical practices, sharing needles among intravenous drug users, and less commonly through sexual transmission. Like hepatitis B, hepatitis C can also lead to chronic liver disease. Hepatitis D, HDV. HDV is unique in that it only affects individuals who are already infected with hepatitis B. It's considered a satellite virus because it relies on hepatitis B to replicate. HDV infection can accelerate the progression of liver disease. Hepatitis E, HEV. Hepatitis E is predominantly transmitted through consuming water or food contaminated with the virus. It's common in areas with inadequate sanitation, and while often acute, it can be more severe, particularly in pregnant women. Aside from viruses, other contributors to hepatitis include alcohol abuse, medications, toxins, autoimmune disorders, metabolic conditions, and fatty liver diseases. Manifestations of symptoms. Symptoms of hepatitis vary depending on the type and stage of infection. Common indicators include fatigue, jaundice, yellowing of the skin and eyes, dark in urine, abdominal discomfort or pain, pale-colored stool, joint pain, loss of appetite, nausea and vomiting, fever. It's important to note that some individuals infected with hepatitis viruses may remain asymptomatic, particularly during the initial phases of infection. This underscores the significance of timely diagnosis and screening, as untreated hepatitis can culminate in severe liver impairment or failure. Now, let's come to embrace preventive measures. Efforts to mitigate hepatitis necessitate a multifaceted approach, encompassing vaccination, prudent practices, and the dissemination of awareness. Vaccination. Highly efficacious vaccines are available for hepatitis A and B, particularly crucial for at-risk groups such as healthcare workers, travelers to high-prevalence regions, and individuals with multiple sexual partners. These vaccines offer robust preventive measures. Hygiene and sanitation. Rigorous adherence to hygiene practices, such as thorough hand-washing and the consumption of clean food and water, significantly reduces the risk of contracting hepatitis A and E. Prudent practices. Evading needle sharing, adopting safe sexual behaviors, and undergoing hepatitis C testing if in a high-risk group are pivotal actions to curtail the transmission of these viruses. Screening and testing. Regular screening and testing contribute to the early detection of hepatitis infections, allowing for swift medical intervention and the prevention of severe complications. Awareness and education. Enhancing understanding of the diverse hepatitis types, their transmission modes, and preventive strategies plays a pivotal role in reducing the overall burden of the disease. In conclusion, hepatitis, characterized by liver inflammation, encompasses a wide range of viral infections. A nuanced understanding of the various types, underlying causes, symptoms, and preventive measures associated with hepatitis is essential for safeguarding public health. By advocating for vaccination, informed practices, and heightened awareness, collaborative efforts can effectively curb the global impact of hepatitis, fostering healthier communities on a worldwide scale. As we conclude our overview exploration of hepatitis, armed with knowledge about the different types, causes, symptoms, and preventive measures, we're better equipped to protect ourselves and our loved ones. Regular screenings, safe sexual practices, and a commitment to hygiene can go a long way in preventing hepatitis and its potential complications. Thank you for joining us today. Let's spread awareness, foster understanding, and work together towards a world where hepatitis is no longer a widespread threat. Stay informed, stay proactive, and let's create a healthier future, free from the shadow of hepatitis. Until next time, stay well.